This is assessment video 1 for Nursing 210. We're going to start off by inspecting the upper and lower extremities of the skin. Start off by looking at the upper extremities, color, the temperature of the skin, texture, turgor, looking at hair distribution pattern. Going to go to the lower extremity. Also looking at color, temperature, texture, turgor, hair distribution, looking to see if there's any lesions, edema, or any varicosities. Next, we're going to be checking the nails. We're looking at the color, condition, capillary refill, looking at the nails, the thickness, firmness, how well they adhere to the nail bed. You could go like this for me. Looking at the contour and shape of the nail, see if there's any clubbing. Now we're going to look at the head and face. Looking at the head to see if it's looking at the size, shape, and symmetry of the head. Looking at the scalp, the size, shape, and symmetry of the scalp. Looking to see the hair distribution, the pattern of the hair, quality of the hair, texture. Looking to see if there's any lesions present. Also palpating, seeing if there's any tenderness. Is there any tenderness? Then we're going to palpate the paranasal sinuses, seeing if there's any tenderness. Is there any tenderness? Checking to see if you have any, checking for TMJ, if you could open and close your jaw. See if there's any click, movement, or crepitus. Now we're going to check cranial nerve number 5, the facial nerve. If you could clench your jaw for me, and push your face up against my hand. And also testing sensation of the face. I'm going to put this in your eye to see if I simulate a blink reflex. Okay, and if you could close your eyes and tell me if this is soft or sharp. Soft. Okay, we were testing the mandibular area and the maxillary area. You can open your eyes for me. Also at this time we check cranial nerve number 7, the trigeminal nerve. If you could smile, frown, purse your lips, puff out your cheeks, raise your eyebrows, and show me your teeth. Okay, thank you. Now we're going to check the eyes. First, we're checking cranial nerve number 2, the optic nerve, checking for 3 tests, looking at the Snellen test, you check for distance vision, the Rosenbaum test, which checks for reading, and then we use the peripheral visual field test for confrontation. If you could close your eyes, I'm sorry, not close your eyes, if you could cover your right eye, and when you see me do this, let me know. Now. Okay. Now. Okay. Now. Okay. Next section, we're checking the muscle movement of the eye, checking cranial nerve number 3, the oculomotor nerve, cranial nerve number 4, the trochlear nerve, and cranial nerve number 6, the abducens cranial nerve. Check this first by the 6 positions of gaze. If you could follow my pen light with your eyes. Do corneal light reflex, seeing if there's any twinkling in the eye. We also do the cover-uncover test. You can cover your right eye for me. And with your left eye, look at my pointer finger. And as you uncover your right eye, continue to look at my pointer finger with both eyes. Okay, thank you. We're inspecting and palpating the eye. We're inspecting the eyelashes, eyebrows, eyelids, fissures of the eye, looking to see if there's lid lag, looking at the symmetry of the eye, looking at the iris, the cornea, the sclera of the eye, looking at the pupil, looking at the conjunctiva of the eye, looking at the overall appearance of the eye. And with the ophthalmoscope, we're going to be checking the red reflex. Usually that would be done under a dark dim light. Looking into the eye, looking at the optic disc, looking at the color, clarity, looking at the margins of the eye, looking through the cup of the eye, looking at the retinal background, looking at the AV crossing and ratio. We're looking at the overall position of the globe of the eye. Let me check the lacrimal sac. If you can close your eyes for me, I'm going to palpate that. Okay, open them. We've checked everything of the eye, so we're going to go ahead and scan the room. As I'm scanning the room, if you mind scooting over to where I was sitting. You can turn that way a little bit and actually scoot towards me. For this part of the exam, we're going to be checking the ears. First, we're looking at the external ear, looking at the auricle and the pinna, looking at the mastoid area, looking at the overall appearance of the ear. We're looking to see if they're symmetric with one another. We look at the external ear canal. Once we inspect inside the ear, looking for the cone of light reflex. We're assessing the inner bones of the ear, the umba, the pars tensa, malleus, and the pars flaccida. As you check the ears, in this section, you're going to check for hearing as well. Checking the hearing is the cranial nerve number 8, the acoustic nerve. First, we're going to start off by the Weber and Renée task. Let me know if you can hear this with one or the other ear or both ears. Okay. And then, let me know if you're able to hear this. Yes. Let me know when you don't hear it anymore. No. Do you hear it now? Do you feel it now? No. Let me know when you don't feel it. No. Okay. And then also during this test, during testing cranial nerve number 8, we're going to be testing using the whisper test. If you could cover your left ear and let me know what I'm saying. Okay, if you could cover your right ear and tell me what I'm saying to you in the left ear. Video. Okay, we've assessed the ears. Now we're going to check the nose. Checking the nose, we're looking at the overall size, shape, symmetry of the nose. We're going to check the patency of the nose. If you could cover your right nostril and breathe in, and cover your left nostril and breathe in. You lift up your chin for me. We're looking at the nose, looking at the septum, mucosa, turbinate. We're going to check olfactory nerve number 1 for smell. If you could tell me what this smells like to you.
Cranberry.
Okay. That's assessing the nose. Now we move down to assessing the mouth. We're looking at the overall appearance of the mouth, looking at the lips. You can open your mouth. You want to turn facing the camera. You can open your mouth for me. Looking at the tongue, looking at the teeth. If you can pull your cheek to the side, looking at the buccal mucosa, do it again on the other side. If you could pull your upper lip, your upper lip up, looking at the Stenson frenulum, if you could do the same for the lower, the Wharton's frenulum, looking at the sublingual area, also taking a note of the gums and teeth. If you could, again, open your mouth and stick your head back, looking at the hard and soft palate. If you could open your mouth and say ah for me. Looking at the uvula, making sure that it shakes up and down within midline. And also seeing if she has any tonsils. That's checking the 9th cranial nerve, the glossopharyngeal nerve. Checking cranial nerve number 10, the hypoglossal nerve. If you could stick your tongue out and move it up and down and side to side. Okay, thank you. Now we're going to be checking the throat, the neck area. We're inspecting the position, size, shape, and symmetry of the neck. We're looking at the trachea, looking at the position of the trachea, if it's symmetrical. Looking at the thyroid, if you can swallow for me. Looking at the position and symmetry as it moves up and down as she swallows. Checking spinal accessory nerve number 11. If you could shrug your shoulders against mine and push your face against my hand again. And if you could bend your neck forward, and we're going to test range of motion. And if you could do that again by yourself. We also at this time check the carotid artery, making sure there's no bruits or occlusions. And also palpating the carotid to make sure that you do feel the pulse. And then at this time, we go ahead and assess the lymph nodes. We start with a preauricular, postauricular, submaxillary, submental, the anterior and superior cervical chain. Check the supraclavicular lymph nodes. We've checked to see if she has any tonsils. We checked the sublingual area when we were assessing her mouth. So this should conclude video 1.